most combat veterans will say they will jump on a hand grenade or would have for the rest of their friends. The sad reality is that once they return from that combat, they lose that camaraderie and they think, if I make that phone call, then I'm not actually helping my friend. And it's like, wow, you'll jump on a hand grenade and take your own life to save someone else's, but you won't pick up a phone to save their life. And so I think it's important to note that making those phone calls, asking for help, dialing 988 option 1 is going to be something that's going to change their life for the better.
Suicide prevention is in every single thing that we do. It's the interactions that we have with other individuals, it's the connection that we make, it's the service that we provide, and every step of the way. It doesn't have to just look like intervention. You can make a difference by just connecting with a veteran in the community, and you can make a difference by connecting with somebody who maybe has lost somebody to suicide. The Governor's Challenge is an initiative brought on by the federal VA and SAMHSA to try to get states involved in activities that work for their state that maybe align with the overall strategic plan for reducing suicide among veterans. What our Governor's Challenge does is in our strategic plan, as a result of the Governor's Challenge, it focuses on 3 main areas, and that's identifying service members, veterans, and families, and screening for suicide risk. Improving care transition and promoting connectedness, and then increasing lethal means safety and safety planning. And overall, it's a public health approach because it's combining 2 different ways of dealing with public health issues, and that is the clinical side and also the community side, and trying to find a way that we can use both of those sides to have a well-rounded approach to reducing suicide.
So what we're trying to do is shift the language and shift the direction to be more proactive, and protective factors is what we're looking at. Because a lot of times in suicidology, we become so focused on basically almost gatekeeper training or youth suicide support. It kind of all devolves into that, which are good things, don't get me wrong. But what we're trying to do is be able to change the language to be able to give people hope and resiliency to be able to handle these things that are coming at them.
So we have a suicide prevention peer specialist team, and a big part of their job is to go out and to provide workshops and connection to communities. They're regionally located. We have a Northwestern peer specialist, a Southwestern peer specialist, a Central Washington peer specialist, and our Eastern Washington peer specialist is specifically tasked with rural veterans and engaging them in access to resources and education around suicide prevention.
Suicide prevention is about handling individuals in crisis, as well as, and this is kind of the most important part, is the outreach events. Because a lot of times that suicide is a momentary transitory crisis period. It's short in duration. It's very hard to reach people within that 10 to an hour window. So what we're trying to do is build connectivity and community with our veteran groups to build basically resiliency and better quality of lives, so they aren't getting to the point where suicide is starting to become an option.
I am one of the people trained to give suicide prevention training to other people. We use the LEARN training from Forefront, which is through the School of Social Work at the University of Washington. It stands for Look for Signs, Empathize and Listen, Ask the question directly about suicide, Reduce the risks, and then next steps, which would be a warm handoff to a counselor, a mental health professional, a counselor on a college campus, or to the crisis center, which is now 988.
I enjoy the aspect of getting to help people work through challenging times and challenging situations. I myself have gone through a few, and if it wasn't for people like myself that are now helping the veterans, I think that I'd probably be in a whole different place. And so I really want to pay that forward and pass it on to the next generation. When they go into the civilian community, there's not a lot of options or opportunities to have that camaraderie that they had while on active duty. And so working with veterans and letting them know that that's still out there, they have that sense of belonging, that sense of connectedness, then it allows them to be more open and more vulnerable to discuss when they have problems or if they have issues or concerns that arise. And they don't feel as if they're going to be a burden when they go and they ask for that assistance.
We offer a lot of different things. We offer training, collaboration, but I think one of the most important things we're doing is peer support and peer outreach. Because as we're starting to realize and learn throughout this work is that it is about human connection. That's what it ties back down to, is the connectivity. And so that's what our job is to do, is to go in and be a peer support, peer counselor if we need to, but then connect people with the resources that they are needing in whatever situation there could be in.
Our agency likes to put a lot of focus on the community, not just veterans themselves, but those military families. When we look at our data in Washington State, and we look at our veterans that are dying by suicide, most of the time, the only person they talk to is their intimate partner. They're the closest with, right? Their caregiver, their life partner. And so we like to put a big emphasis on that military family. Because
crisis moments and high emotional stress, they're very real. And I need to tell people this, that it is a very real moment. They're dealing with very complex things. And a lot of times that emotion gets so heightened. That's where suicide comes in, is people are trying to escape that intense pain or emotion that they can't get away from. And if we can get through that, everybody here listening to it, talking to you, we've all been through our worst days, and that's all we're trying to do, is get people to get through their worst day, so we then can work on getting them out of whatever situation that's been driving them to this point.
And if they reach out for help and they share that, going back to that concept of camaraderie and teamwork, they are setting an example for the next generation to follow. And so that way they're not afraid to ask for that assistance or ask for that help.
I noticed that within the agency, everyone is really passionate about what they do, and I noticed that a lot of people go above and beyond to make sure that the job is done.
we have the DVA website that's suicide prevention specific, and it has a lot of our program information. But if there's a need to get in contact with one of our program specialists or myself, you can always email connect@dva.wa.gov.